Good morning. Thank you for being with us today. All of you must have found on your seats a copy of the new edition of the Stavros Niarchos Foundation News and Grants, which includes the new grants approved during the latest board meeting. At the same time, it also includes an overview of the main actions and initiatives of the last 6 months. This is the reason why we're here today, to announce and present to you the new grants of the foundation and to tell you a little bit about what's been happening in the last few months. Let me begin with Mr. John Zervakis, who is the Chief Operating Officer of the Athens office. He will be talking about the underlying philosophy and the actions of the foundation, but he'll also be talking about the key initiatives of the foundation. Then we will give the floor to the grant managers from the main areas of action, i.e. education, social welfare, health, arts and culture. Mr. Zervakis has the floor. Thank you very much. Given the fact that my colleagues will be analytically talking about the philosophy and the logic behind the 67 grants totaling 16 million, which were adopted by the Board of Directors in its latest meeting, I would like to dwell on 2 points. The first has to do with providing information on the recent initiative undertaken by the Foundation on youth unemployment. And the second point has to do with the general philosophy governing the Foundation on the way in which it responds to the incoming messages it receives. And I'm not referring, of course, to the assessment tools. I'm not going to talk about the initiative which was announced 2 years ago. This is our contribution to addressing the consequences of the Greek crisis. This is underway. 80% of the amount has already been dispersed. 20% remains, and we believe that we will have dispersed this till the end of the year. And then, of course, we'll do the stock taking of the particular action. I'd like to begin with the action on recharging the youth. In October, we announced that we would contribute 100 million euro to combat this very acute problem. We know, of course, our position. We are not the state. We are not a profit-making company. We are a philanthropic organization. We can't create new jobs. So what we can do is help promote employment through education and other actions, which we will also be announcing. So it is within this context that we organized a conference on the 3rd and 4th of April in New York, where there were academics, economists, businessmen, representatives of NGOs and other foundations. There was an analytical discussion on youth unemployment, both at a global level. We also talked about what works and what doesn't work when it comes to youth unemployment, what we could do in Greece in order to tackle youth unemployment in Greece, because every country is different, which means that we couldn't just take an action from elsewhere and apply it as it is in Greece. At the same time, we talked about various actions we've been working on as far as entrepreneurship is concerned, rural development, but also cultural tourism. We will all be given the opportunity to follow this discussion during the first day of the conference organized every summer by the Foundation. This will be the 3rd conference on philanthropy, and we will dedicate this day to youth unemployment. I'd now like to move on to the second point I'd like to discuss with you, i.e. the underlying philosophy of the Foundation. So let me say that, first of all, we know very well that in order for the current situation to change in Greece, no matter how much money one has, this is never enough. So in order for us to do something, what we need is partnerships, innovative ideas, and of course there needs to be collaboration of all stakeholders, be they philanthropic organizations, private sector, companies, and the public sector. So we have a clear-cut role. We are a philanthropic organization. We're not replacing anybody. We're here to complement actions undertaken by the private and public sector. So we want to help as much as we can to the best of our ability in order for our children to have a better future. At the same time, we are promoting collective action. So what we believe is that problems that are outside the door of our house or outside our workplace are also our problems. Why should a homeless person be a problem of local government and of the state and not our problem? I don't think that we are proud of what's happening around us, but there are very few people who really try to contribute in their own way. It doesn't mean that you have to offer money. You can become a volunteer. You can pick up a phone and help somebody. But there are very few people who actually do this. And we would like to do as much as we can, and we try to communicate this need for more and more people to become involved. We also believe that every individual deserves our attention. We know that in all our actions we try to maximize the benefit derived, but this doesn't mean that we exclude actions with a smaller impact. Every person counts for us. Of course, we can't help everyone, but we will listen to people's problems, and if we can't help them, we will try to link them up with others who could possibly help them. So why do we do all this? We do all this because we believe that philanthropy, i.e. seeing things through other people's eyes and entering into other people's shoes, is an element of humanity. This helps promote society. This is something we could discuss later. I'd like to stop here and give the floor to my colleagues. Thank you very much. I now give the floor to Mrs. Anna Maria Kosmoglou, who will talk about arts and culture. Good afternoon, ladies and gentlemen. In the field of arts and culture, we'd like to present two grants. We believe they're very important grants. They were recently adopted by our board of directors. But before moving on and giving you the details about these two grants, let me tell you a little bit more about the approach we follow at the foundation in this particular area. Arts and culture. Generally, promoting arts and culture, in our opinion, is very important. We see these two sectors as very important creative forms of capital, as drivers for growth and prosperity, which is why in the established annual conference we organize this summer, we have foreseen a special reference to arts and culture and to how important they are for the growth and economic, social development of a country. Now, more specifically about the 25 grants in the area of arts and culture that have been adopted since October. There are some main axes which have been selected. We're talking mainly about the support of important cultural institutions inside and outside Greece. We believe that these institutions are channels to support art, promote Greek culture, but also provide training to young artists, the younger generation of artists. I'd like to mention some examples. Let me begin from America, the Director's Lab of Lincoln Center Theater, which allows Greek Greek directors to go on the spot and talk to rising directors from around the globe. Another typical example is the grant to the New York Philharmonic, which provides innovative programs, cultural education programs for pupils. So we cover all ages of artists. Now let's come closer to Greece. Let's go to Europe. Here one can say that the recent grants are around one of the main aims of the foundation, i.e. the promotion of Greek culture abroad. And this can be seen through 2 grants to 2 museums for 2 forthcoming museums, one in the Louvre Museum on Rhodes and the other in the Archaeological Museum in Basel on the Antikythera mechanism, the well-known exhibition which is still on at the Archaeological Museum of Athens. So, before going to Greece, let me talk about the first grant that we'd like to present to you, the University of Yale, the Yale School of Fine Art. This is one of the significant grants. This initiative was announced in February of 2014. The amount is 5.9 million, and it's for the support of the Yale School of Fine Art in general and its action. Let me tell you a little bit about the Yale School of Fine Art. It's the first university school of fine art in the U.S. Yale tradition begins in 1832. This school, as a school of fine art, was established in 1869. It is now considered one of the most renowned schools of fine art, not just in the US, but all over the world. It has undergraduate studies and postgraduate studies in graphic design, photography, sculpture, printmaking, and art, painting. All the permanent staff are professional artists. They can collaborate with successful artists who visit the School of Fine Art, the main aim being to create an environment where students can develop their talent, their full potential, and achieve better prospects. Now, let me talk about what is foreseen. We're talking about a permanent endowment for the School of Fine Art, which will allow it to remain sustainable in the long term. It will allow the Yale School of Fine Art to implement its main priorities in order to further develop its objective. Another thing also has to do with the further support to 3 endowments which were already made in 2010 under another grant covering 3 fields of action, i.e. the creation of a scholarship program for international students, a hospitality program, art residencies, and the creation of the Deanship Resource Fund. This allows the school, but these particular fields of action to be further developed, and we want to provide support to methods of teaching, the teaching staff, creation of exhibitions, and many other things as well. The creation of the permanent deanship Stavros Niarchos. This is of particular importance because this is a deanship which will be there for many years, and it will allow the Yale to further develop what it does in the field of fine arts. I'd like to say that this grant is one of the most important grants of the foundation for a school of fine art. But this is only a part of the general collaboration the Stavros Niarchos Foundation has with the Yale University. Let me mention some parts of our collaboration. In 2007, under another grant, we had the establishment of Center for Greek Studies, Stavros Niarchos. We have also supported the Center for the Study of Globalization. We've also supported the scholarship program, the Peabody Natural Museum, and a Center for Study of Children. And 2 days from now, on Thursday, in the premises, there will be a celebration to celebrate this long-standing cooperation between the foundation and Yale University. And there we will have a lot of the grantees from the university also participating in the ceremony. Now let's go back to Greece. We're still in the area of arts and culture. culture. A recent grant which was approved is to the Athens School of Fine Arts for the relocation of the library to the new building which has been created in the campus in the area of Piraeus. And there's also going to be a lecture room, a multi-purpose center, again in the new building. We believe that both these two parts of the grant help upgrade the services that can be provided by the school to the students, and we know that this will be to the benefit of the students in general. The second important grant we'd like to talk about today is the one to the National Museum of Contemporary Art. This grant was announced recently. It is of the order of 3 million. It's for the completion of the reconstruction work of the well-known building, the old Fix plant. We believe that this is a very important grant. It was expected, it's been discussed at length, and we know, we hope, or rather it is true that thanks to this grant, this effort will be completed, and Athenians, visitors, both Greek and foreigners, will be able to come to the new building, admire the building, admire the collections and the exhibitions in the museum in the new premises. More specifically, as far as this grant is concerned, what does it do? It helps upgrade and implement the museological study of the museum. It has included the purchase of general and special equipment and the presentation of the permanent exhibitions by covering the cost for transfer and installation of the works of art in the new building and the general layout of the exhibition areas in this new building. When this work is completed, Athens will possess one of the most modern museums in Athens and in Greece in general. Of course, the operation of this museum is very important because thanks to this building, the museum will be able to develop its aesthetic, educational and scientific work, which is already important but which will become even more important. It will increase the number of visitors coming to the museum. There will be more space for actions, not just exhibitions, but also parallel actions. Now, as far as the broader benefits are concerned, let me also point out that thanks to this grant and the completion of this work, a very important example of the architectural heritage of the city is now offered to the public in the urban landscape, and this is the building of the Fix brewery itself. It also helps create an important cultural area because the operation of the museum is in close proximity with the Acropolis Museum and the Acropolis Archaeological Site. But we also have the creation of a route, a cultural route, starting from the Acropolis, going to the National Museum of Contemporary Art, then to the Onassis Cultural Center, and heading towards the sea, it ends up in the Stavros Niarchos Cultural Center, which is now being constructed. So before closing, let me add one last thing. This was a dream we've had for many years. It's been discussed extensively, and I hope that with this grant, the museum will be able not to start, but to continue and further develop its work. Thank you very much, and we wish it the very best of success. And now Mrs. Eva Polizogopoulou will talk about grants in the area of education. Good afternoon, ladies and gentlemen. I will continue and talk about the area of education on which we've placed great emphasis. We believe that it can truly help a country, particularly in countries like Greece at times of socio-economic crisis. So we believe that education has an important role to play. It helps cultivate ethos in young people, and it helps in their further development. So on the basis of this idea, we try to support efforts that have a double aim. One, access to knowledge, and two, creating the conditions which will allow us to have a society in which all participate. And this is what Mr. Zervakis mentioned before, civic engagement, citizens who are interested in participating in solving problems facing society. In the last 5 months, the board approved 37 grants in this area in 7 countries, placing emphasis on Greece, which is usually the case. Before we move on to the specific grant, as you can see from the slide, let me give you examples of grants which were approved under this last cycle. Let's start from the environment. There we place emphasis on organizations that deal with the environment. In this case, it was the Ornithological Society and Greenpeace. What we want to promote is environmental protection, but also a healthy and sustainable way of life. The main aim being to help have conscientious citizens. We also want to facilitate access to knowledge to a lot of young people worldwide who lack this possibility. So we provide money for tutorials, mobile telephony, and having access to information society in Africa, but also another innovative program in the US where students can monitor medical procedures or operations, the main aim being to arouse their interest in order for them to later pursue such a career. Now, Recharging Youth, one of the latest initiatives. So there we tried through this new cycle of grants to provide education and training to young people. And of course, one of the main objectives was to help these people find a job. We also focused on different scholarship programs open to Greek students in foreign universities. Another emphasis is placed by the Stavros Niarchos Foundation is promoting Hellenism abroad and preserving the Greek cultural identity abroad. We have supported studies, Greek and Byzantine studies, lately in Greece, but in Europe as well, and in the US. We want to support such faculties and disseminate Greek culture. This is one of our main aims. So it is within this context that we had an idea, yet another dream, for a program, and this program is at the very cradle of Byzantium, i.e. Istanbul. So this new Center of Studies for Late Antiquity and Byzantium at the Koç University in Istanbul is the materialization of this vision which we had. This vision was the result of careful assessment, but we also wanted to make sure that history was presented in an objective manner. Before talking about the grant, let me talk to you a little bit about this university. It was established in 1993. It is already considered one of the top 3 universities in Turkey. It ranks 31st worldwide on universities that have a history of under 5 years. It has a very good scholarship program, and it manages to attract the best Turkish students. It manages to get very good students out of those sitting university entrance exams. Let me give you a little bit of information about the scholarship program. It covers 75% of the 5.5 students. They receive a partial or full scholarship. 75% of the professors have acquired their degrees in Europe and or the US. The university has received many excellence awards, and it has participated in 57 European programs. At the same time, every 3 years it organizes the only symposium of Byzantine studies in Turkey with the participation of 250 attendees. So the creation and operation of the center will be supported for 5 years by the Stavros Niarchos Foundation, and this will also be co-financed by the university itself. The idea is to have a postgraduate degree which will offer the following: the possibility to have a postgraduate degree or a doctoral degree, and also archaeological programs addressed to students and scientists from all over the world. Another important element that we'd like to talk to you about has to do with the fact that this is the first such research center in Turkey. And we consider this very important, and it fills us with optimism on what we mentioned before, i.e. the objective dissemination of Byzantine history, but also it will also help strengthen the ties between Greece and Turkey. It will be placed under the Faculty of Humanities and Social Sciences. There will be one executive board, the head of the center, and 4 professors in the beginning. Every year, 3 scholarships of 1 or 2 years will be offered to post-doc students without any problems regarding nationality, whereas 6 students can be enrolled every year, and the possibility will be given to at least 2 scholars of other centers in the university to carry out research and on matters related to Byzantine history. At the same time, the center will also organize conferences and will publish editions on Byzantium and Byzantine history according to the timeline. As you can see, the operation is expected to begin next autumn, the autumn of 2014, and of course the courses will be in English. I know I gave you a lot of details. I hope I didn't tire you, but before closing, let me focus on what we consider important, i.e. the educational process. And I think it's important to mention these elements, and I think this has to do with a smooth and seamless operation of any university. And to our surprise, we came across all these elements, i.e. very good cooperation between professors and students, the promotion of innovation and critical thinking, but also the creation of a flexible, non-bureaucratic, interdisciplinary and favorable educational environment which is centered on the students and their prospects. On the basis of the above, particularly in light of what I just said, I think this is a step in the right direction to promote Byzantine heritage, and I believe that other similar examples will follow in the future. Thank you very much. And now Mrs. Mitsopoulou will talk about the area of social welfare. Good afternoon. Welcome, everyone. I will try very briefly and succinctly to give you some background information about social welfare and what we've been doing since October. We're talking about 30 grants amounting to 4.8 million euro, and then my colleagues and I will be talking about some important grants, and we'll give you more details about that. We know that unemployment, particularly youth unemployment, have become one of the most important challenges of our times, and we of course have the initiative on recharging the youth. Mr. John Zervakis already talked about it, but I'd like to say that this year we have focused on initiatives combating youth unemployment all over Europe, but in the rest of the world as well, and in the US in particular. Action for Children and international network of Street, Fundación Exit in Spain, and Bottomless Closets in the US. So with the grants to these organizations, we improve employability of young people, we provide training, young people who are at risk of social exclusion. Thank you very much. At the same time, in close collaboration with large organizations in Europe like the JP Morgan Foundation and Fondazione Cariplo, large foundations, we become strategic partners in a very particular program of the EU, which is to enhance social entrepreneurship in Europe and in the rest of the world, which is called Benisi. Of course, as far as social welfare is concerned, we continue steadily to support programs which help vulnerable groups, not just in Greece, but in the rest of the world as well. So it is within this framework, according to the latest trends for care to children with disabilities, we support 2 programs with Anemone and ELEPAP for early intervention, and we also try to provide help to destitute families at the parish Methodist Church of St. Andreas and the Friends of the Child, but also leading organizations like Broadway Housing Communities and City Harvest in the US. And let me talk to you a little bit more about City Harvest. I was fortunate enough to see the great job done by City Harvest in a very important sector, that of food security, in a very difficult city, that of New York. And it has wonderful monuments and museums, but it also has a population of 54,000 homeless people. This population is on the rise, and according to surveys, over 1.5 million people cannot afford to buy food, so they are undergoing food insecurity. So people from City Harvest started working 30 years ago in New York, and they were pioneers in collecting surplus food and distributing it to populations in need. Since then, they've been pioneers, and they have developed best practices in food security in general. So they are working very methodically. They have 18 trucks and many motorbikes crisscrossing the city every day, and they manage to collect over 23,000 tons of food per year. It's a huge number, and they give it to 2 million people of New York who really need it. City Harvest also complements this main action with many training programs affecting 20,000 people a year, many information campaigns, many volunteer actions and work, and they also have the Healthy Neighborhoods program. This is something we had supported with a grant in 2011, and they really are interested in collecting, harvesting, and distributing fresh food. Their 5-year strategic plan, 2011-2016, and it's quite successful. It's already been running for 3-4 years. And the support of this program is what we aim to do with our grant. It's 1 million for 2 years. So we have ambitious goals, 27,000 of surplus food, 16,000 of which is fresh food, 500 programs, and we intend to cover the entire city. With City Harvest, we've been working for many years, and we've learned a lot about what we can do in Greece as well in this particular field. People from City Harvest have come to Greece. They visited Greece quite a few times. They've seen the action of other organizations dealing with food security in Athens, and they're working very closely for some time now with with Boruma, for example, which is one of our trustees. So it is a great honor and joy for us to support them in their work and to make them achieve even more than what they've already achieved so far. Thank you very much. Now, Mrs. Rosalind Benjamin will talk about the action of the Foundation in the area of health. Thank you. Mrs. Rosalind Benjamin. In the area of health, in the spring of 2014, the Foundation approved grants to 8 organizations in Greece and the US, amounting to 2.5 million euro, aiming at providing patient care, research, and education. Supporting these 3 things is very important in order for us to improve human health. Improving care and widening access to health care are 2 of the main principles of our grants in the area of health. Our grants in Greece support the upgrading of facilities in large university hospitals in 2 of the biggest cities in Greece. This financial support is of vital importance in the current situation because available resources for renovation are limited. Renovation and buying new equipment will help pediatric, dermatological, and surgical services offered to the public in various parts of Greece. In the last few years, the Foundation is running a program to upgrade ICU for children and neonates in order to provide high-quality services in all hospitals in the land that have a pediatric intensive care unit. So we're talking about renovation, purchasing of equipment for children's ICU and the neonates unit in the General Hospital in Thessaloniki, Hippokration, but also in the General University Hospital of Patras, the General University Hospital of Heraklion, the Regional General Hospital Pedon Aglaïas Kyriakou, the General Hospital, that is a University Hospital of Ioannina, and the Children's Hospital Agia Sophia. But the grant for the upgrading of children's ICU units is not just for the purchasing of equipment and renovation works. The AHEPA University Hospital has been running since 1951. Its capacity 680 permanent beds. It offers medical services to the wider area of Thrace and Macedonia. The second pediatric clinic has been running since 1974. There are 12 departments, one of which is for neuromuscular disorders, the child oncology, child cardiology, but also the emergency department. 2,500 children come to the pediatric clinic every year, and in the emergency department there are approximately 12,000 visits per year. Our grant is for the renovation, but also for purchasing of medical equipment covering an area of 450 square meters. There will be 7 treatment wards, 2 of which will be converted to negative pressure wards. We also have neonate wards with 4 beds, a playground, various supporting areas and medical equipment, but also the doctor's offices. So we know that the infrastructure sometimes makes people's lives difficult at a time when we see that there are more and more cases that need to be hospitalized. Together with the closing down of the former infectious diseases hospital in Thessaloniki, where now pediatric cases are sent to Hippokration and AHEPA, the upgrading of the facilities is considered necessary in order to meet the needs that are on the rise. This will allow us to have high quality infrastructure but also high quality care. Thank you very much. Now Mrs. Ioanna Kyose will present 2 of the most important initiatives, the food program, the program for promoting a healthy diet, and the mobile medical units. Thank you very much. Good afternoon. Whereas my colleagues just presented the grants which were recently adopted by our board of directors, we will now take you to the other side of grants, i.e. the implementation and the results we've had so far, meaning how this affects the targeted group. As an example, we will give you an overview of 2 large programs or initiatives of the Foundation, which are part of the initiative of the 100 million euro to tackle the negative effects of the crisis. The first is the food program, the program for food and promotion of a healthy diet. This program is one of the largest initiatives of the Foundation, carried out in collaboration with the Prevention Institute. This program is an effort to deal with problems of food insecurity that children going to state schools which have been in areas which have been severely affected by the crisis. At the same time, emphasis is placed on a healthy diet and promoting healthy dietary habits, not just through the meal offered to the children, but also through educational, entertaining, interactive activities addressed both to parents and children. The meals are provided to all the pupils and students in schools participating in the program in order to avoid stigma. I'll just give you a brief summary of where we stand today and how this program started. It started as a pilot and it was implemented from April to June of 2012 with the participation of 6,600 children in 34 schools in Athens and Thessaloniki. After the completion of the pilot phase, the program was evaluated. We looked at the implementation and the necessity of the program. Let me mention here that whereas up until the moment there were extensive press articles on food insecurity facing children, there were no figures. So through the pilot phase, we were given the opportunity to collect the first figures. And according to these figures, 52% of children participating in the pilot phase of the project had food insecurity, whereas 23% seemed to be facing problems related to starvation. Taking this into account, but also how important and necessary this program was, in July of 2012, the board of the foundation renewed its grant to the Prevention Institute for the expansion of the program for school year 2012-2013. This program was completed in June of 2013 with the participation of 25,349 children in 162 schools in 13 prefectures all over Greece. So according to the new data we collected, because we had more children participating this time in the program, we saw that 60% of the children always participating in the program face food insecurity, whereas 23% of the children have problems related to starvation. But there was also a positive result here, i.e. that 90% of the children participating in the program improved their dietary habits. Now let's go to school year 2013-2014. Right now, the program is implemented with a participation of 61,870 pupils and students in 406 schools in 23 prefectures covering the whole of Greece. You can see the map on the left-hand side. Now, let's talk a little bit about meeting dietary needs and how the program is designed. The program has been designed by doctors and nutritionists. And for the production of the meal, high-quality ingredients are used, exclusively Greek products. On the left, you can see exclusively olive oil, whole wheat flour, 60%. There are no preservatives. We use dairy products, a lot of different fruit and vegetables. And as I said, these are Greek products. It is estimated to meet 20 to 30% of daily needs of each student. Here you can see the energy needs met 20 to 30%, proteins offered 50%, natural fibers 50%, other nutrients, for example, we also have calcium, 40 to 50% of needs are covered, daily needs, and iron 20 to 30%. So we have constant and close monitoring of prolepsis at an administrative level. This is what makes this program of high quality and so unique. Now, let us look at some results, the results from school year 2012-2013. I will talk about food insecurity. Food security 40%, it ended at 44%, and food insecurity without hunger 37%, it remained 37%, and with hunger it was 23% and went down to 19%. We also had another change, the change in the body mass index of children. And let us not forget that Greece ranks first in Europe and worldwide as far as child obesity is concerned. Here we see that 48% of underweight children became of normal weight when the program ended. Out of the obese, 13 becomes of normal weight, only 34% is considered overweight, and as far as overweight children are concerned, 32 of these became of normal weight. I will now be showing you some minimum expected benefits for the program for the school year 2013-2014. This is based on the results we had in the school year 2012-2013, but also the characteristics of the children and their families for this school year, 2013-2014. So we see that those who will move from food insecurity with hunger to food insecurity without hunger reaches a percentage of 39.8%, whereas as far as food insecurity without hunger to food security, there's a change, a significant change. The percentage is 26.3%, and we see that 31.4% of the children participating in the program will have an improvement as far as their food security status is concerned. Now let's look at the weight of children. Here you can see some statistics. This is what we expect to see at the end of the program for 2013-2014. From 47.3% obese, we'll have overweight and normal weight. We'll see that 32% of overweight children will become of normal weight, and 48% of underweight will become of normal weight. There are multiple benefits for this program, but I can't give you any figures right now. So we managed to combat cases of food insecurity. There's a financial benefit for the families because these are free meals given to all the children attending the schools. We have better dietary habits. There is a reduction in school dropout, an improvement of school performance. It's good because it improves the relationship between the parents and the school. It's good because it helps the teachers because the children have a better performance, and all schools participating in this program have these meals offered to the children going to these schools. So let's leave food and a good diet aside, and let's move on to another important initiative undertaken by the foundation. I'm talking about mobile medical units. These mobile medical units are an initiative of our foundation together with the Olympic Village Polyclinic. And this is a 5-year national program for the promotion of primary health care in islands and remote areas of Greece. The grant of the foundation is related to the purchase of 2 state-of-the-art mobile units together with the accompanying medical equipment, together with a modern MRI machine, as well as the financing of this 5-year project. So what is the purpose here? The purpose is to offer free, comprehensive health care and support services to people living in islands and remote areas. At the same time, it provides information and training to the public as far as prevention is concerned, but also protection of one's health. During each mission, we have discussions about the danger related to smoking, how to prevent obesity, vocational guidance, but also first aid courses are also offered. It is important to mention that for every patient examined, an electronic file is created, including the patient's medical profile. This is then entered into the records and is saved for future use. Now, let me point out that these mobile medical units are staffed as follows. There are 26 doctors and scientists offering their work on a voluntary basis. So the specialties are pediatrician, gynecologist, cardiologist, dentist, orthopedic specialist, ophthalmologist, pneumonologist, surgeon, neurologist, etc. In 5 years, we've planned to carry out 35 missions in our islands and remote areas, and we estimate to examine 55,000 individuals. Now, it's important to mention that it takes 1 month to prepare each mission. So during this month, the appointments are booked by the inhabitants, and a team goes on the spot in order to prepare for the installation of the mobile medical units. On the 9th of January 2014, we had the inauguration. 3 missions have been completed to date with great success, and we are preparing the 4th mission. More specifically, the first mission, the mobile medical units were in Castellorizo Castellorizo from the 17th of January to the 20th of January. Let me point out that Castellorizo only has one doctor doing his residency, and a lot of people have to go to Rhodes, which means they have to take the boat. It's a 4-hour boat trip. Out of the 213 inhabitants, 193 were examined. There were 795 visits, 148 examinations were carried out, 40 mammograms, pap smears. And let me talk a little bit about the evaluation which took place and how they decided where the mobile medical units would go. So they saw that in the areas they would be going to, no women had done a pap smear or a mammogram. Let me go back to Castellorizo. All 60 children of the island were examined. This was a full checkup. And from remote Castellorizo, we go to the easternmost island of the Aegean, Amargos. This was the second mission from the 6th of March to the 11th of March. This is when the mobile medical units were on the island of Amorgos. Let me tell you a little bit about the medical staff. In the last 1.5 years, Amorgos has a general practitioner, but for more specialized examinations, the inhabitants have to take the boat. It's an 8-hour boat trip to Piraeus. So during this mission, there were 2,067 medical visits, 887 examinations, 214 cases of ultrasound, 171 electrocardiograms, ECGs, 123 X-rays. So this is very good. And whenever there was need for more specialized testing, these people were referred to the Olympic Village Polyclinic. The third mission was to Kassos. Again, with the volunteer doctors, these medical mobile units were on the island of Kassos from the 9th of April to the 14th of April. In the last 3 years, Kassos has one GP, and for any medical examination, the inhabitants have to go by boat either to Piraeus, it's 24 hours away, or they can alternatively go to Rhodes. 648 people were examined. There were 1,637 appointments, 1,048 paraclinic and lab tests. 9 people were diagnosed with serious health problems, and 42 patients had to be operated on. But this was a scheduled operation. So what are our next stops for 2014? Astipalea, Saint Evstratios, Psara, Patmos, Pholekandros, Sikindos, and Fourni. So from the results achieved so far, it can clearly be seen that this program has 2 innovative characteristics which make it a very important program. They make it necessary. So it offers the opportunity, first of all, to clients so that they can have access to good services. So these people are no longer in risk of health exclusion, and I'm referring to the people on islands and remote areas. Now at a time of crisis, because we know that the crisis has had a big impact on the health sector. Thank you very much. Thank you all very much. We would now like to take questions. We would like to answer these questions. Just a minute so that you can get the microphone. You presented a lot of data, and you didn't mention that on the island of Castellorizo there were 2 cardiological problems that were diagnosed. They would have been fatal, and one of the 2 patients was a child, but nobody had noticed this. And we know that if children take up sport and they have cardiological problems, they can die on field. It's very important that this was diagnosed. Are there any other questions? If there are no further questions, there will be a light lunch offered at the back of the room. Thank you very much for coming here today.